did you guys feel prepared for this scenario?
Yeah. So we have a huge staff, over 3,000 employees, and then hundreds of doctors on our medical staff. We're a level 1 trauma center, and like Mr. Gauding said, we've been in that status for quite some time, and that involves having a lot of specialists on call for the hospital, a very dedicated trauma team for 24/7 coverage, and unfortunately we deal with events like this very frequently, violence in the community of various sorts, and so our teams are very ready to deal with this type of event.
And do you have any updates, specifics you're able to give about the two that are in critical condition at this time? Maybe like where they were shot or anything like that?
I can't share any of that information at this time, but sorry.
The last time we had a press conference similar to this was with the Virginia Beach mass shooting. We're here again. I guess what goes through your mind as the chief medical officer with these very serious violent acts?
So obviously with the health system or the hospital, what goes through our mind is how can we be ready for this? I think as a human being, as a father, as a family member of many people, my thought goes into how do we as a community prevent this kind of thing from happening so that we don't have this occur in the first place. So those are the thoughts that go through my mind.
Does the hospital have any avenues for mental trauma for patients that are going through this right now?
There are a number of resources available to patients and families. So we have a chaplaincy team that's been on site since very early this morning, working with families or working directly with patients. We obviously have mental health services in the hospital, including psychiatry if that's necessary for any of the patients. And then there's a number of community resources that we can plug people into as they transition out of the hospital, because this is obviously a serious life-changing event for them.
What resources are available for healthcare workers, the nurses, the staff that have to see such terrible acts play out?
So we have a number of resources available. We have a employee assistance program that has therapists on call 24/7 for these type of crises if someone needs to access that type of care. Obviously, as leaders in the hospital, we try to talk with the people that are having to go through this, debrief with them, and figure out if there's specific resources that they may need. Our chaplaincy service that I talked about earlier also works with our employees to try to make sure that we know when it's been too much.
What's the one thing you want the community to know in light of this tragedy on your side of things?
Well, I think the community needs to know that they've got a great hospital with tons of great people that really work endlessly to be prepared for these types of events. So there's some comfort in that. But I think all of us would like to not have to do this, not have to take care of these types of issues, and anything that the community can do to help us prevent gun violence or violence of any kind. We would love for all of us to pull together to do that.
Can we put Dr. Burgess up? About ready? Dr. Burgess was here on site last night. She came in to backfill when the attending, was busy. So describe what's going on.
Sure. Yeah, again, my name is Jessica Burgess. I'm one of the acute care surgeons here at Eastern Virginia Medical School in Sentara Norfolk General. I was the backup person on call last night, and I was called in by my partner when we got reports that there was a mass casualty incident. So I sort of enacted our emergency plan to get other people involved, other surgeons, other surgical residents, operating room staff together so that we were prepared for as many victims as we might potentially have.
And I understand that, when you're in that mode, you're thinking very logically, strategically, but as a person, just kind of what was going through your mind, just kind of realizing what would happen?
Sure. Certainly as a surgeon, this is what I love, is taking care of people and being able to be there in these kind of situations, and being able to help people when they're in most need. Certainly as a parent and spouse and just a member of this community, it is heartbreaking. It was just 2 days ago that I was contacting one of my colleagues at Colorado Springs, wishing her well and checking in to see how she was doing after she had just taken care of shooting victims. So it's very disheartening that now I'm in the same position with my colleagues from across the country checking in on me and our team. So it is disheartening, and it's hard when sometimes there's only so much we can do after the injuries have already been done.
Did you have enough beds for the patients last night? Because I know initially it was reported that there were 5 that were being taken care of, and then we found out later that one may have been at a different hospital. So can you maybe help fill in the blanks of what happened there?
Sure. Well, so we drill for these types of things on a regular basis, especially with the recent COVID pandemic. Hospital capacity is always a big issue on the forefront. But this is something we drill on a regular basis. So we were immediately able to make ICU beds, operating rooms available. We had staff calling in to see how they could help, and had multiple different teams of people in. So we were able to handle more than the patients that we received. Sure, it's a Burgess, Burgess.
And your title again?
I'm an acute care surgeon and an associate professor at Eastern Virginia Medical School.
How is your team doing today? I know they worked long hours. How are they doing today, this morning, as they kind of recuperate?
Sure, I think obviously as the dust settles, you start to think more about it. We had a debriefing afterwards. The chaplains were present. We've had multiple people of Dr. Hooper and from administration reaching out to check on us. We've gotten multiple communications from both Eastern Virginia Medical School as well as Sentara, reaching out with different mental health resources. So I think, again, this is what we want to do. This is where we want to be. So we're proud of what we did last night. I think I couldn't be more proud of the team that we had together, how people came out of the woodwork to be able to be here. And I don't think our team could have done a better job. And again, I'm proud of what we did. But again, it's a lot to process. These are people in our community whose lives were cut short the day before Thanksgiving. It's heartbreaking.
And we know that we just spoke with Mr. Jones as well. Have you been in touch with any of the other victims' families? How are they doing?
Yeah, I really can't speak to that, but we're on taking care of them and in contact. Yep.
Feel good? Tracy's on deck. Tracy Chandler manages the burn trauma unit, the ICU where our patients are, and this is part of her team.
All right, and Rachel, she is one of the team coordinators down in their emergency department, so.
You guys just step it closer to the mic.
Yep.
Absolutely.
Thank you. Perfect.
Amy, you want to introduce yourself?
And my name is Amy Sokolowski. I'm the nurse specialist for the burn trauma and vascular ICU.
And this is kind of the same question for you ladies. I know you trained for this, but when it actually happens, what's going through your mind? I know you have to make sure that everybody's okay and you do your very best, but at some level, we all know it's heartbreaking, but I guess what do you guys do to keep going, essentially?
As a leader of the emergency department, to Dr. Burgess's point, we train for this. As a leader, a charge nurse, a staff nurse on some occasions, you're constantly thinking one step ahead. If I need to move this critical patient out of this room at this moment, when they call the trauma alert, who's my first to come out? And that's exactly what the team did. We have our spots that we keep loose and nimble so that if we need to pull somebody out, we can do it immediately. And then they did exactly that. They were quick to respond, get the stretchers in the right places, designate where that team needed to go. We have a board in place to help direct that traffic as things are coming in, because it can be a little chaotic, and it really takes good, clear communication to make sure that everyone knows what their role is and where does that patient need to go, and then think about what's the next step. Where are we going after this? Are we going to diagnostics? Are we partnering with our ICU team and getting a bed positioned upstairs? Or are we going straight to the OR and we're on the horn with the OR staff?
I can't imagine anybody coming here early this morning and getting that horrible news. Is there can you describe the
the disheartening thing is that it's happened, and when we don't have all of the answers at that moment, it's hard to be able to communicate to the best of your ability. And so we rely heavily on our chaplaincy services. We rely heavily on coordinating with the floors, taking information down, trying to identify that spokesperson so that when we do have the information to provide, we can relay that to the individuals. We have soft areas where it's a pseudo reunification area if we have the ability to support it. That's in our waiting area. And our chaplaincy service is really good about connecting the family with the information when they have it and it comes available. In a situation like this, it's really important to get that information, so as the information comes, we are able to connect the dots for them.
And we understand gun violence is prevalent across the nation. Norfolk, Old Hampton Roads, no stranger to it. Does it get tiring seeing the gun violence across the city and the area?
Yes, it does. It's always disheartening when you see unnecessary violence on this level. We do have a lot of resources for our staff because some of these situations it pulls at your heartstrings, but during that moment, I will say that our teams do really good at, coming together, supporting each other. Our unit personally have suffered our own personal tragedies in the past year and a half, so we have, not gun violence tragedy, let me clarify that, but, we do really good sticking together and helping each other out. Last night, the team did an amazing job moving patients so we can make room for these patients as they're coming in. They kept in contact with me. I'm always on standby if they need. Amy, my nurse specialist, is always on standby if we need help. Our director, she always is very willing to come in and, help if we need it. So it's.
One of the things we found very important is Dr. Burgess mentioned the debrief, and we've found significant value in taking that pause, whether it's the senseless act of a mass casualty incident or the code that happens that wasn't expected, or another act of violence. And we take that pause, we talk about what was it that went really well, and where is it that we want to take our program, and it's a lot of good has come out of it.
The spellings of your name, starting with Tracy.
Yep. Tracey, and Chandler, Chandler.
And your title?
Clinical nurse manager.
And it's Rachel E.L. Hoovinen, Huovinen, and it's team coordinator of the emergency department.
Is that be like Victor?
Yes.
And it's Amy, A-M-Y, Sokolowski. It's S-O-K-O-L-O-W-S-K-I. And I'm the nurse specialist for the burn trauma and vascular ICU.
Did anyone have to go into the burn unit last night or early this morning?
The burn trauma is one unit, so yes,
Yeah.
we received some of the victims, yes.
Oh, okay. So it's just called burn trauma, but it's
It's called BTU.
Yeah.
Trauma.
Yeah.
Burn trauma, vascular intensive care unit, yes ma'am.
Burns or traumatic injuries.
So you guys were here last night. You're still here.
No, I wasn't here last night.
Oh,
no,
you
no.
weren't here last night. Okay.
I was not here last night either.
Gotcha. You were the over.
Yes.
Gotcha.